So my name's Liz Sapey. I'm a professor of acute and respiratory medicine, and I am the new president of the Association of Physicians of GB and Ireland.
Okay, we're going to get onto the presidency shortly. We've literally just finished APAM 26. It's the end of the second day. We are literally the last two people here. How's it been for you? Try and sum up the past 2 days.
It's been incredibly inspiring. It's been so exciting. I feel my medical knowledge has had a complete refresh, which is wonderful across so many specialties. And what I loved the most was seeing what's coming next in the future. The medical students and the early career researchers were phenomenal. So spending time with them, hearing about the work that they've been doing and learning about their future plans and how the association can help them was just incredible.
That's brilliant. So, as you say, you're the brand new president. What is it you're looking forward to most about being president of the AOP GBI?
Being president is a real privilege, and I feel very fortunate to have been selected for this. I really want to focus on that next generation piece. We know that clinical academics are getting older. We know we need a lot of fresh blood in there, and we know we've got incredible talent across our medical schools and in our resident doctors. So it's about finding that talent and giving opportunities for them to be able to take part in research and develop their own academic clinical careers. So I want to start thinking about and working on a programme to really unlock that potential across the UK.
It's making it an attractive direction, because there's people are coming into medicine, but there's a lot of people, they want to be doctors. It isn't about the research, it isn't about that side of things, but it is making it attractive, isn't it, I guess?
Yes, I think being at the cutting edge of your field is the most important thing you can be for your patients. And actually directing that through research is probably the most important thing you can do to provide the best care possible for the patient in front of you. So I don't see research and clinical care as being two separate things. I see them as one leads to the other, one informs the other, and one makes you the best doctor that you can be. So I want people to not think about research as something extra they could do, but see how it's actually part of their everyday practice all the time.
Excellent. So there's a couple of things. I want to talk about the AOP, because there's going to be people watching this who obviously be aware of the AOP GBI, but they've never considered becoming a member. Why should they? Give me the benefits of being a member.
I think the benefits of being a member of the AOP come into three things. First, you get to learn so much across different specialties by mixing with people who are absolutely at the top of their game. Secondly, you get to work with early career researchers and medical students in order to make sure that the people coming up behind us who are at that earlier point on the conveyor belt are as excited about their career as we were when we set off. And I think third, it's to really make a difference to your field and others. Being there, having those discussions, sharing your knowledge can really shape what other people do with the kind of patients you look after.
Yeah.
It's an incredible community, and being part of that is really exciting.
Yeah. I'm interested. I'm just going to pick up on something you talked about there, about that kind of level of excitement. How has your level of excitement changed from now compared to when you were first starting? Not necessarily whether it's greater or lesser, but, you know, the quality of the excitement, I guess.
Yeah. So I think when you're a resident doctor, when you're starting out in your career, everything's exciting. I mean, exciting stroke terrifying, right? It's all the same. Everything is new. And as you become more experienced as a doctor, you've sort of seen similar things before. You know what to expect. You know how things are likely to turn out. And although giving the care to people and making them feel better still feels as great now as it did when I started, part of the real excitement is looking at some of my more junior colleagues and helping them get that journey right as well, and making them recognise that there are so many opportunities as a person working in medicine. You can do so much good That's where the excitement comes now. So maybe it's less about what I do day to day now, and it's more about what I help other people do that really drives me.
Yeah, that's lovely. And there's going to be people watching this, third year med students, people who've, maybe they're just kind of in their residency. There's going to be some who decades into their career. Why should they think about attending APAM 27?
I think all clinical practitioners and students should think about attending. It's such a broad range of medicine that you learn about. So it will be great for your clinical practice, and it will really make you think differently about the health problems that you see. You'll also make great colleagues. I mean, there are some fantastic people that attend these meetings, new people all the time, and being able to make those friendships in different specialties across the country will undoubtedly enrich your experience in life. But I think there's also something about being part of a community and really being able to add to that. So from a young medical student, they might really worry about coming and talking to some gnarly old person like me, but we love it when they do because it's so nice to get that fresh perspective and excitement. So those collaborations, those friendships that you make, they don't have to be within your direct peer group. They cross specialties, they cross their seniorities. And some of the loveliest things are seeing students come when they were third years, now they're fifth years, now they're resident doctors, and learning about their journeys at this one touch point we have, which is at the Association of Physicians meeting.
Thanks very much.
Thank you.